back to In the Know, where we speak with, interview, and have discussions with knowledgeable and informed people so that you too can be in the know. We're back here again with our state representative, Steve Toth, for more information regarding the coronavirus and how it is affecting or could affect the elderly. Steve, thanks so much.
Wait.
I'm
Don't
so
forget.
glad.
Okay,
You're right.
come on.
Coronavirus handshake now. Okay. Thank you for seeing us
Yeah.
again and making the time.
You bet.
We've all been watching the news and hearing about everything, but tell us where all this is. You've been in touch with our state health gurus and so on. What do we need to know, and how do we need to be careful, and how can we advise our loved ones?
So for elderly folks, we've had a lot of. I can't count the number of people that have said, "Hey, man, there are a lot of people that don't have health insurance that are here in Texas. There are elderly people that are on Medicare. There are poor people that are on Medicaid.
Mm-hmm.
What do we do? Will there be some massive outbreak among the poor and the elderly with COVID-19? And there's just a lot of misinformation about this right now. So, as an example, with either the elderly or the poor, whether you're on Medicare, as a senior citizen would be, or someone that is impoverished and you're on Medicaid,
Mm-hmm.
you would go to your physician that you're already seeing through Medicare or Medicaid.
Yes.
And you'd call them and you'd say, either I was around somebody that had coronavirus and I'm starting to have some symptoms,
Mm-hmm.
or you have no symptoms at all, but you were concerned because you shook their hand and later found out that they had COVID-19. What you would do is you'd call your healthcare professional and you'd share this with them, and then you wouldn't go to the hospital. It's not what you want to do first. You want to contact your healthcare professional first.
Okay.
They will then tell you what to do.
Because you're not supposed to be carrying this around
Right,
with you,
right.
showing up at
You don't
the
wanna-
hospital or someplace else.
You don't want to show up at the hospital glad-handing people, slapping them on the back.
Mm-hmm.
The best thing to do is call ahead, and then your healthcare professional will either bring you into his office or her office, or send you to. We're blessed in that we're in one of the largest medical districts, hospital districts in the state of Texas. Some of the most incredible healthcare facilities.
Right.
And they'll tell you what to do. But here's the blessing. The blessing is that whether you're on Medicare or Medicaid, there is no copay. So if there's a concern or a fear that you're not going to have the money to pay for it, the state of Texas through Medicaid, the federal government through Medicare, there should not be any out-of-pocket expenses whatsoever. And if any healthcare professional is trying to charge you, then you need to call my office, 281-770-7287. That's 281-770-7287. No one should be charging you a copay or any out-of-pocket expense whatsoever to be checked for coronavirus. All right? But again, call ahead. That's the key thing. Call ahead. Make sure that they know that you're coming.
Wonderful. And please, and you've made note of Steve's phone number, and we'll run it across the bottom of the screen again for you. Steve, what about allocations of testing kits? We all are tuned into the news, and all the news bites are, well, there's 1 million of them being produced, but only 70,000 of them got delivered, or who knows what the numbers are.
Anyone that needs a test is getting a test. And
Period.
So, period. End of story. We have not. We've not heard any reports of healthcare facilities saying, "Wow, wish we could do more tests. We just are out of them right now." That's not been the case.
Okay. So that's just bogus noise that some newscasters.
There's so much misinformation that is going on right now, and it's really unfortunate.
What about, what do you know about, and how does that reflect on what could potentially happen here in Texas or anywhere in the United States about them shutting down portions of Italy?
Oh, isn't that wild?
Yeah.
So northern Italy, right,
Yeah.
the Milan area, they've literally quarantined the top third of the nation. No one in, no one out. And see, that's one of the issues, right, is that there are so many people in Italy that have it right now that that they don't even know where the hotspot is anymore. And so they just quarantine basically the top third, of the northern third of the nation. But it goes also to the reality that there's so many people that are carrying it. Like we're saying that there are 550 plus people in the United States that have it right now. There could be several thousand for all we know that have it.
But please don't be alarmed.
No, I mean, the reality
There's
is
more that, there's 10 times that have the regular flu that you can catch.
They have the regular flu, but the reality is that, and this is what Dr. John Hellish said from the Texas Department of State Health Services told us, is that the vast majority of these people are asymptomatic. They don't even know that they have it,
Okay.
which is why the mortality rate is so much lower than we really believe it, than we can really know at this point. We don't know how low it is. We know, again, as of Monday, this past Monday, that it was 3.5% US, 3.6% worldwide. The reality is it's significantly lower than that once we realize just how many people actually have it.
Steve, is there anyone within a 15-mile radius of where we're sitting that's been diagnosed with the coronavirus? Do you know this information?
There are people in Harris County that live in Harris County that have been diagnosed and that have it.
Okay.
There's no one that lives in Montgomery County that has it. But what we have to understand is that, again, we have one of the largest hospital districts in Texas, right here in South Montgomery County, which means at some point, yes, we're going to have people in our healthcare facilities that are being treated for it.
So, advice is elderly. Well, first off, elderly, don't worry. In other words, you're covered. It's, you go to your doctor.
Don't worry.
Call your doctor.
Call your doctor.
Don't go to your doctor.
Call your doctor. Call your doctor first. Again, at the end of the day, there should be no copay. No one should be charged a copay for getting tested for COVID-19.
Okay. And other preparations, I know we spoke when you were kind enough to do our first segment with us. We spoke about what do we need to be sort of review.
Yeah. Just real quickly,
yes.
You don't need to be washing your hands every 5 minutes. You need to wash your hands as necessary. So if you're out and about in a public area and you're touching public contact points, whether it's a desk surface, a table, a doorknob, a railing, I would, once you've gotten to your destination, go to the bathroom and wash your hands. And do not touch your nose and eyes.
Right.
And if you're not if a restroom or sink is not accessible, carry some Purell with you. If you don't have Purell, we've contacted the CDC. I put a short little video up on my Facebook page. Two-thirds rubbing alcohol, which is 99% isopropyl alcohol, not the 70%, but the 99%.
Okay.
And then 1/3 aloe vera lotion.
Okay.
And you just mix those two together, and now you have your own Purell.
At a fraction of the cost.
At a fraction of the cost. Now, if you go to the store, you're going to find that you can't get you can get the aloe vera, you can't get the rubbing alcohol.
Oh, the 99%.
However, Dollar General, we've had some people that have called the office and said, wow, people from the Woodlands don't go to Dollar General. They're going to Walmart, they're going to CVS, and they can't find it there. Go to Dollar General, they've got it. They probably won't after they see this.
Yes.
They'll probably be cleaned out. But there's also, if you want to go to Specs and buy grain alcohol, clear grain alcohol that's 190 proof, that actually is 90% alcohol. It's 190 proof, but it's 90% alcohol. And so you can use that with aloe vera as well. And again, just...
Or you could mix it with juices and things and drink it. Is that also appropriate?
It doesn't work from the inside out.
Oh no, I meant just for consumption in general.
Yes,
the grain
I
alcohol.
guess so.
Yeah.
Yes,
Okay.
but
not for the reasons that.
So you're talking to a recovering Baptist here. So I don't know about that.
Sorry.
But for clarity, after Hank took us in the wrong direction,
I apologize.
190 proof grain alcohol will do the same thing for you that isopropyl alcohol.
Okay.
So it's
for the mixture.
2/3 of a cup of the isopropyl alcohol, 1/3 cup of the aloe vera lotion. If you want to put some essential oils in it, 8 drops to give it a nice smell, you can do that as well. But just mix it all together and then just put it in a little squeeze dispenser and carry that with you and keep your hands clean. And don't touch your eyes and nose, Hank.
Yeah, I just did this. I just
Don't
rubbed my
be
nose.
doing that. I know, I
just
do it all
rubbed-
the time,
I
too.
just rubbed my nose. Sounds like we've got a new business here being born. It's the Toth hand sanitizer.
Free of charge.
Love it, love it. Steve, thank you for your
Thanks, Hank.
insight, your advice, and wishing
You
you all the very best
Yeah.
in the coming
Let's-
weeks. And let's hope that
Let's do what we can do to help keep
Yes.
this thing on the straight and narrow and not allow it to turn into a panic situation.
fantastic.
Amen. Okay?
All right, no
All right.
panic, and remember, you're in the know because you view our podcast of In the Know with Hank Van Joslin. Thank you.